Go.
Hi, and welcome to our presentation of the danger of chronic traumatic encephalopathy, otherwise known as CTE. Here, it's presented by my partner here, Emmanuel
Emmanuel is.
Evans, and myself, Ruby Press.
All right, so here we have our table of contents. Just give you a quick overview of what this presentation will be about. So first we have an overview. We're gonna have a little introduction video where we're gonna explain a little about CTE and what it is. And then next we're gonna go into more detail. Ruby's gonna talk about understanding CTE, what is it, how CTE occurs, so like how does it happen, symptoms of CTE, what are the consequences after CTE develops in the brain. And then I'm going to take over and talk about the different stages of CTE. There's 4 stages, and we'll go more into detail about what those each look like later on. How to prevent CTE, what measures can be taken in order to prevent this disease from occurring in the brain. Next steps, where does research go next in dealing with CTE? And then conclusion, where we talk about our overall summary of our findings.
Next, we have here is an overview video where Dr. Ann McKean explains what CTE is.
So chronic traumatic encephalopathy is a progressive neurodegeneration. The most common neurodegeneration that we know about is Alzheimer's disease, but CTE is similar. But in this case, in the case of CTE, it's triggered by repetitive head trauma. And we think that after sufficient amounts of head trauma, this disease starts to develop in your brain and then becomes a progressive, widespread brain disease as time goes on. So CTE is defined neuropathologically. You can't even make the diagnosis without a neuropathological examination of the brain tissue. What we look for under the microscope is the deposition of an abnormal tau protein that clusters around blood vessels in the brain. And that's a very distinct lesion. It's a specific lesion for CTE. There's no other disease that causes those changes in tau protein. And that's how we make the distinctive diagnosis. The symptoms of CTE can be variable, but oftentimes it's a personality shift, a behavioral change, maybe mood changes like depression. There are things like aggression and violent behaviors, impulsivity, a short fuse. Another common set of symptoms is memory loss and difficulty planning and organizing and difficulty with attention. What we see are just isolated lesions, very tiny lesions in the cortex of the brain or in the gray matter of the brain. They haven't spread to the other parts of the brain. It's just isolated focal lesions. That's how it starts out. That's the mildest form. That's what we see in the youngest individuals that we've looked at with CTE. When it gets more severe, and it gets more severe with aging, it tends to spread to other parts of the nervous system. It spreads to other parts of the gray matter. It spreads to the deep nuclei of the brain stem, and it even can spread to the spinal cord. Eventually, it becomes quite a devastating disorder with abundant tau protein in many, many regions of the brain. CTE in different individuals can manifest quite differently. Some people will be impulsive and violent. Other people will feel a mental fogginess and a lack of clarity, a feeling like they've lost control over their brain or their thinking. And it varies from individual to individual. We're not exactly sure why those differences occur, but we think it has to do with the location of the lesions. Maybe one individual has it in the frontal cortex or the frontal pole. Another person may have it inferior temporally. And those different parts of the brain are very different in what they do. So the temporal lobes, aggression, impulsivity, the frontal lobes, sort of judgment, decision making, and the combination of the pathology, where it is in the brain, determines what symptoms you might present.
All right, moving on, we have the definition where what CTE is. It's a brain condition that is connected with duplicated blows to the head. This also comes to reach out with the reproducement of dementia, which is a common term for loss of memory. How it occurs. It would normally occur to people who played football, boxing, and other contact sports. This could also occur from several years of normal, repetitive brain trauma. Symptoms of CTE. This would most likely include memory loss, confusion, personality changes, as well as increased aggression, the shorter attention span, and inability to organize thoughts, and also difficulty with balances and loss of motor skills.
And to dive a little deeper into what Ruby was talking about, so there's 4 stages of CTE, and it's basically how the symptoms are divided up. So in stage 1, you will start to notice like mild memory loss, start of depressive symptoms, or even increased aggression. And then stage 2, you will begin to see like mood and behavioral shifts, including like potential severe depression and explosive outbursts. But these are still both classified as like mild symptoms, where they're not like necessarily deadly yet. Now, where we get into stage 3 and 4, this is where the symptoms become more deadly to the patient. So stage 3, they become cognitively impaired, facing memory loss, visual-spatial difficulties, aggression, headaches, apathy, impulsivity, and even suicidal thoughts. And then stage 4 is the most severe stage of CTE, where they experience executive dysfunction, dementia, loss of attention, loss of concentration, and even language deficiencies. How to prevent CTE? So currently, there's only one well-known way to prevent CTE. It's just to completely avoid activities where repeated head trauma is occurring. So basically, don't play contact sports and try not to get in accidents. But to dive more into detail, you can try and reduce the number of concussions, prevent additional injury after a concussion, and overall, like I said, reduce mild traumatic brain injuries. Next steps. So for CTE research, the next steps, we need to be able to diagnose CTE in living patients, because currently there's no concrete way to diagnose a living patient with CTE. The only way they can actually properly diagnose somebody is if they do an autopsy and they have the entire brain where they can scan it. So that is a very big step that needs to be taken in CTE research. Next, improve equipment in contact sports, better concussion protocols, and then increase public awareness about the dangers of repetitive head impacts and subconcussive hits. So I'm gonna just talk about a little bit the NFL as a longtime football fan and Charger fan, sadly, go Bolts. The NFL is working with many scientists to create a new helmet that can hopefully decrease the number of concussions and repeated deadly head traumas in the sport. So basically, the NFL teamed with many neuroscientists and in 2016 started the 01 project. So the NFL donated 1.1 million to this research. And basically what they're trying to do is head impact in the NFL occurs from acceleration, which makes it so deadly. And the 2 ways to decrease acceleration is to increase the time of impact, and that's what they're trying to do, or to just decrease the speed. So the speed is not gonna change. You can't change the way they're gonna play football, how fast they play. But what they can try and do is increase the time of impact. So they're trying to design a new helmet where normally now they have the padding inside or whatever to try and like help cushion the blow. But now they're gonna try and like add a new layer on the outer shell right across the top here. This layer on the old helmets, they're going to try and add a liquid layer because it absorbs more damage than solids, because liquids absorb more than solids. So they're gonna try and add like a liquid layer on the outside of the helmet and also make the helmet more flexible so it can like bend with the hits and like the direction of the hits are coming from. So they want to try and make the helmet more flexible, and they want to add the liquid layer along the top to try and absorb more of the contact to increase the time of impact that it takes to get to the brain. So these are just some steps that the NFL are taking to try and promote safer play in football.
Wow, that's really important too, you know, because like one could honestly just lose their life in an instant, and that's only just because like, you know, the helmet wasn't strong enough or like built enough, you know, to protect that important part of their body. But yeah,
Exactly.
that's really important. And so here we have the conclusion where we just sum up everything that has been told. And here we are saying that CTE is a neurodegenerative disease that occurs later in the lives of people with a history of repeated head trauma. It is reported to be grouped with the following activities: American football, as Emmanuel explained, and then there is boxing, as well as soccer, hockey, and even with physical abuse, epilepsy, and head banging behaviors. Um, CTE symptoms consist of memory loss, disordered cognition, sorry, and ruling dysfunctional, apathy, depression, irritability, and even signs of Parkinson's. There is a long-term research that is being conducted to find a potential cure to neuropathology, head trauma, and CTE.
Yeah. And as Ruby was saying, currently there is no cure to CTE. So that is what they are going to try and figure out next as well as diagnosing it in living patients. But overall, that is our presentation. Here's some of our sources. Most of our sources was just paraphrase. It wasn't like direct quotes. So and that's our presentation. Thank you for joining us.
Thank you.